my first placement, just 5 days in, I was attacked by a... Hello everyone, welcome back to Psych Nurse 101. Today we're going to be exploring a crucial aspect of our profession, which is incident reporting in mental health settings. So incident reporting isn't just paperwork. It is a key element in ensuring patient and staff safety, managing risk and fostering continuous learning. It's also necessary to become familiar with your incident reporting system. These things should be shown in perhaps your induction to your maybe hospital, or if possible, maybe a friend could show you. I say a friend, a staff member. So there are so many different types of incidents or events that can occur on shift. For example, somebody getting attacked, medication errors, short staffing, not having enough people to work on, and based on the acuity of the work. Those are incidents. People even slipping on a floor, that is an incident. Losing a key, incident. You catch my drift. So let's say in the face of a challenging event, such as an attack, it's crucial to not only seek help from others, but to meticulously document everything in detail. So who's involved, what happened prior, was there maybe any medications involved, how did you seek help? All of those things need to be documented, and they should be time specific, location specific, detail, factual. No opinions. And by doing this, you create a record of what's actually happened. So then when people can review this, or this is discussed in a debrief, you're actually able to reflect on your own practice. And so this actually promotes an improvement in your practice to not trigger this event from reoccurring again, because then you're able to see, oh, what caused this, what happened. So that's the main things. So let me share with you a personal story of mine to underline this. So during my first placement, just 5 days in, I was attacked by an elderly patient with Parkinson's. It was unexpected and quite scary, because she really shocked me. She started strangling me. And so anyway, thankfully, just 5 days prior, I had actually learned the breakaway techniques. And I honestly believe that prevented me from having any serious neck injuries or harms. So despite this encounter, at the time, I didn't seek any immediate medical attention. I was quite young. I was a novice. I just took some paracetamol. In retrospect, I should have actually gone to A&E or made an appointment with occupational health. So reflecting on my experience, I realized that attack could have been prevented with better staffing allocation that day. The healthcare assistants were in the staff room, the nurses were in the nursing station, and I was a young novice left alone with the patients all in the day area. I was encouraged to have patient contact without being adequately informed about their potential risks. Funny thing is, I did highlight this prior that, look, you're keeping me here by myself. I don't know these people, you know, but the nurses didn't listen. They just went about their merry way. Fine. So going back to the actual incident itself, like once like I was like fine, I reported this to the deputy nurse, who literally advised me to just reflect on it. But it wasn't until my second year when I met with a practice development nurse, and they tend to speak to students, and they were just like, oh, do you know what a Datix is? And they just want to have feedback, or like if there's ever been time when you have felt uncomfortable. Me being me, I just opened up about this situation. And she was really disappointed in how it was managed, in that essentially certain protocols just wasn't followed. So she's the one who introduced me to incident reporting, and it was also a failed learning experience for me, in that I was deprived of the potential health support. So it's not really helpful if you've been strangled to tell somebody to just, reflect on it. Is it like, maybe I should have tilted my head this way? Or, I should have gone to OcuHealth. I should have got checked out, and a Datix should have been completed. And most importantly, I should not have been left alone on a ward with no patients. And we didn't even use alarms, actually. When I think about it, we don't use alarms. That was, and talking to that deputy nurse, that was probably one of the worst debriefs I've ever had, because nothing was like really resolved. But so you look back and you just laugh at how dangerous that is, because if that was to happen now, that would be a big issue. And to be fair, that is a big issue anyway. So having this discussion with this practice development nurse meant I was actually able to now have this long, well overdue debrief. So this brings me on to discuss the values of having a debrief. And debriefing is all about discussing with the patient, like, what's happened, being able to have a discussion with your team about the situation and how maybe you've handled things in certain incidents. These are all very beneficial. And it's important to discuss these incidents so you're not left having to dwell on things on your own. Especially, it's a time to have that voice, to voice your concern. So in my case, I couldn't have a debrief with the patient because that patient had dementia, very severe dementia. But that didn't mean that the incident wasn't worth discussing or learning from. So here's my advice. Take incident reporting very seriously. It's about learning. It's about improving. It's about protecting yourselves, your colleagues, and ensuring better patient care. So I briefly touched on this earlier, but I just wanted to reiterate. So when creating an incident report, remember to include the key details: what happened, who was involved, how you approached the situation. Keep it factual and unbiased. Your goal here is to provide a clear picture of the incident to help the team learn and to prevent similar occurrences from happening in the future. Let's quickly recap what we've discussed today. Incident reporting is a crucial aspect of mental health nursing, involving clear documentation of what happened, who was involved, and how the situation was handled. We've discussed the importance of taking this process seriously, learning from incidents and sharing experiences within your team. I've shared a personal story to underline this and discussed some preventative measures to take. As always, if you're unsure about the process of incident reporting, don't hesitate to ask your colleagues or seniors for help. Document every detail, report it as soon as you can, and maintain your own record of the event. Even copying the incident into the notes can sometimes be beneficial should it relate to a patient. Remember, we are in this together, continuously learning and improving and taking care of not just our patients, but ourselves and our colleagues. Please like, share, subscribe if you found this helpful, and stay tuned to Psych Nurse 101 for more insights into the mental health nursing profession. Stay safe, everyone, and keep learning. And listen.